All right. Hello, everyone. Thank you for joining us today for the COVID-19 Vaccine Town Hall, Getting Vaccinated in New York City. My name is Dina Pimenova. I am the project coordinator for the NYU Langone Community Health Worker Research and Resource Center, housed in the Department of Population Health at the NYU School of Medicine and supported by the NYU Langone Community Service Plan. Today's event is hosted in partnership with the NYU Community Engagement Alliance Initiative, NYU-CUNY Prevention Research Center, and the NYU H&H Clinical and Translational Science Institute. Next slide, please. Before I introduce our speaker, I would like to briefly go over some housekeeping. Everyone is on mute. The chat box is open for comments and sharing of resources. Please use the Q&A box to submit questions to the speaker. We will have time to answer as many questions as we can during the Q&A portion. Slides and recordings will be made available at a later date, and please be sure to fill out our evaluation questions at the end. Next slide, please. Our agenda for today includes a presentation in which we will learn about the current vaccination rates and efforts in New York City, updates on how to get vaccinated, and the DOHMH's progress on addressing vaccine inequities. This will be followed by a moderated Q&A. Next, please. And I'm very excited to welcome back Dr. Olusimbo Ige, who graciously agreed to talk with us again following a town hall we did back in February. Dr. Ige is the Assistant Commissioner for the Bureau of Health Equity Capacity Building at the New York City's Department of Health. In this role, she works to increase capacity and readiness of community partners and other institutions to address health inequities across New York City. She also leads the COVID-19 community and partner engagement efforts to ensure equity and access and uptake of vaccines by all New Yorkers. I will also introduce our wonderful moderator right now. Ivette Cabrera was born and raised in Brooklyn by her Ecuadorian immigrant parents. She began at NYU Langone Brooklyn Hospital as a community health worker in the emergency room and currently works as the CHW in the high-risk program at the Patient Navigation Center. She serves as a mediator and coordinator to help patients navigate the healthcare system as well as community resources. Ivette is also currently serving on the NYU Langone Community Health Worker Learning Committee. So welcome everyone, thank you. And Dr. Ige, let me know if you're not able to share your slides.
Yes, and I will dive right in. And let me start by saying a big thank you to the NYU Langone family for having me again, and for everyone that's taken time out this afternoon to just brainstorm on next steps with COVID. It's been a long road, a long journey. And I want to be, as frank with you as I can possibly be. In my job as the Assistant Commissioner for Health Equity, there are some things that show up on my table every day that just gives me concern. And I'm going to start with just acknowledging how difficult this year has been. I hope you can see my slide now.
Yes.
Okay, so we like at the Department of Health to start with an acknowledgement. When we show data, when we talk about such difficult issues, we understand that this has been a very stressful and painful year. Many people have suffered the loss of loved ones, the loss of businesses, the loss of homes and livelihoods. And all of this combined with the feelings of uncertainty, sadness, fear, and worry has been a huge weight on us all. We also acknowledge that Black, Indigenous, and people of color have been disproportionately impacted by COVID-19, and that these communities continue to experience and resist daily the impact and reality of years of disinvestment, the years of racism, and the years of biased treatment and oppression. We acknowledge the historical and contemporary injustices in government and in healthcare that have deepened the distrust and contributed to the causes of individual and collective trauma and structural inequities. The health department names racism as a public health crisis, and we commit to becoming an anti-racist institution that acknowledges our history and takes action to eliminate inequities, and that commits to protecting and promoting the health of all New Yorkers. So I start with these acknowledgements and recognize that when I show you some data and say, this is what I see every day, I want to acknowledge that the reason why we're seeing these cases and seeing these inequities is because of the structural racism. It is structural racism that drives policies and practices that makes access to healthcare, that makes access to good quality housing, that makes access to good food difficult and challenging for many people of color. So this is where we are. We have recorded over 1 million cases of COVID to date. Since January 2020 to date, over 1 million cases of COVID have been reported in New York City alone. We have had over 118,000 people hospitalized for COVID. And unfortunately, we have lost over 33,000 New Yorkers untimely, prematurely to COVID. These are the concerns that keep us up. These are the things we worry about. But we also worry that the impact of COVID has been so heavy on the communities that still grapple with the inequities and injustices in our city. People who identify as Black and Latino have had more cases of COVID compared to other population groups. They have been hospitalized at higher rates, as you can see from this chart. And more people of color have succumbed to COVID compared to other population groups. For me, as the Assistant Commissioner for Health Equity, this is a huge concern. And this is why we are working so hard to ensure that this doesn't repeat itself as we see the third wave of this pandemic emerge. There are two charts that I'm showing you here. One is what we have observed from January 2020 to date. We have had one peak earlier in the start of this pandemic. We had a second peak where we saw even more cases than the first wave. And now a third wave has started. And on the 20th of August, we had 1,784 cases on that one day alone. So we have enjoyed a short respite from COVID, and now we are seeing cases build up again. So we are working very hard to ensure that we don't see a repeat of what happened in wave 1 and wave 2. On the right hand there is the number of cases we have recorded over the last 3 months. As you can see, cases have increased quite rapidly compared to what we saw in August, compared to what we saw in May. And we are working very hard to keep this third wave from taking over. As you can see, we're seeing a little stabilization there and a little dip. So there's cause to be hopeful. However, we cannot stop being vigilant. One of the main reasons why we're seeing an increased number of cases is because of the Delta variant. You may have heard that, Delta variant is now circulating in New York City, but it is one of the factors contributing to this increased number of cases that we are seeing in our city. We have had different variants in the past, Alpha, Iota, Gamma, etc. But Delta has become the main variant that is circulating in the city. As at the 20th of August, Delta was responsible for at least 94% of all the infections that we were seeing in the city. What that means is that, if anyone tests positive for COVID today, we can assume that it is Delta. There are other variants, but you can see they make a very, very small percentage of the circulating cases in New York City. Now, why is Delta important? Delta is more contagious. In the past, when we were dealing with previous versions of the virus, one individual could infect up to 2 people if they were in a situation where they were faced with vulnerable people. With Delta, one individual can infect up to 5 people. So this is what we mean when we say Delta is more contagious. It spreads faster, it spreads more quickly. We also have data that suggests that Delta causes more severe illness than previous strains in unvaccinated people. So those who are not vaccinated, they are fully susceptible to infection by Delta, and that is, we're seeing more severe cases than before. So unvaccinated people remain the greatest concern. However, individuals infected with Delta variant, including those who are fully vaccinated with symptomatic breakthrough infections, can transmit the virus to other people. So Delta can be transmitted by both unvaccinated and vaccinated people. So that is a concern. That was not the situation 2 months or 3 months ago when we were dealing with different strains. We also want you to know that fully vaccinated people with Delta variant breakthrough infection can spread the virus to other people. However, vaccinated people appear to be infectious for a shorter period. And those who are coming down with breakthrough infections tend to mostly have asymptomatic infections. So we took a look at all of the cases that we have seen in New York City since January to date to compare vaccinated versus unvaccinated. Who is getting sick? Who is getting hospitalized? Who is dying from COVID? Because there is a lot of concern about breakthrough cases. Every time you switch on your TV, every time you listen to the news, there is some talk of breakthrough cases or the other. But how do we keep this in perspective? So this is the data that we have. This is from New York City residents. This is not clinical trial. This is real data, real life data. Since January the 1st until June 15th, we have had 500,302 cases of COVID. Now, if we break that down, vaccinated versus unvaccinated, we find that 495,023 of those cases, that is 98.9% of these cases, are not fully vaccinated. So by far, the majority of people who are getting sick with COVID are not fully vaccinated. The same thing goes for hospitalizations and death from COVID. So yes, it is true that breakthrough is happening. It is true that some people are being hospitalized. It's true that some people are dying, but 99% of those who are getting sick, those who are being hospitalized, and those who are dying from COVID are those who are not fully vaccinated. This is why we are working so hard to ensure that this third wave, knowing what we know, we can protect as many New Yorkers as possible. Now, these are some numbers. Many times we hear people say, you know what, I just want to wait until more people are vaccinated. I am just not ready. I don't know enough about these vaccines. And many times when we hear on the social media, we're inundated by all the negative news. I want to show you something that is reassuring. As at today, as at yesterday, in the United States alone, 362 million and counting people have been vaccinated and are doing well. These people did not grow horns. They did not lose their fertility. Their limbs did not fall off. They did not become magnetic. These are real human beings that have been vaccinated and are doing well. In New York City alone, this is a city of 8.3 million people. We have vaccinated 5.3 million people with at least one dose, and 4.7 million have been fully vaccinated, received both doses or a single dose of Johnson & Johnson. These are real human beings, friends, neighbors, colleagues, loved ones that have been vaccinated and are doing well. So we want folks to feel encouraged that the majority of residents of this country or residents of New York City have been vaccinated and are doing well. So we don't always hear that on the news. We hear the bad news, we hear the scary news, but we also want folks to know that many, many millions of people have received this vaccine and they are fine. They are doing well. So yes, we have cause to celebrate that many more New Yorkers are protected. However, we have concerns still, because when we break down this number, we realize that some population groups remain unprotected. That we are very excited to see that those who are Native American or Alaska Natives, 80% of them have received at least one dose of the vaccine, 80%. 78% of New Yorkers who identify as Asian or Native Hawaiian or Pacific Islanders have received at least one dose of the vaccine, 78%. But when we look at those who are Hispanic Latino, it is still at 53%. For those who identify as white, we have 50%. And when we break that down, we see that certain communities, certain white communities are still also not protected. However, the population group with the least level of protection are those who are African American or those who identify as Black. That is a concern for us. When we look at age, also, we see that younger people are not as protected. Many of those who are 35, 45 years and older, we already have 80% or more covered with at least one dose. But when we come down to younger ages, 12 years and older, we see that many of the kids remain unprotected. Why is this a concern? Many people say vaccination is my decision. Why should it bother you? I just don't want to be vaccinated. Yes, that it is a personal choice. However, because this is an infectious disease, as long as there is one person with this virus, none of us is safe. That means we're all sitting ducks. The more transmission happens, the more likely we'll have different variants emerge, and nobody is safe as long as this vaccine is circulating. So when we look at these maps, these are two maps comparing locations in New York where we saw the most number of deaths compared to vaccination coverage. So on my right, the gray map is where did we lose a lot of New Yorkers. And the places where we saw a lot of people succumb to COVID in the Bronx, in Brooklyn, in Southeast Queens, and the North Shore of Staten Island. When we look at vaccination coverage today and see, are these locations covered? If there is a third wave, would we be able to sleep at night knowing that they are protected? The answer is no. In the Bronx, we still see lower vaccination coverage. In Southeast Queens, we still see lower vaccination coverage. In Brooklyn, we still see lower vaccination coverage. It means that these communities remain unprotected. And this is a concern. And you will see where you see deep blue there, lower Manhattan, parts of Queens. As of today, Hell's Kitchen is 100% vaccinated. Lower Manhattan, Financial District, Chelsea, Battery Park City, these locations have 100%. All residents who live in those neighborhoods have vaccinated. But these are not the places that suffer the most from COVID. The places that suffer the most from COVID remain unprotected right now. That is an equity concern for us. And this is why we're working. We are all hands on deck, making sure all New Yorkers have the information they need to stay healthy. The New York Department places equity at the foundation of all the work that we do. We have an entire unit dedicated to equity. And we acknowledge that the reason why people are not engaging is the lack of trust. People don't believe what we say. People don't believe what the healthcare workers are saying. People don't believe what the pharmaceuticals are saying, which means we have to work hard to build trust in the medical community and to address the historical and continued mistreatment of people of color, of immigrants, of LGBTQ plus individuals and other groups in New York City that have been mistreated. Because this is why people don't trust us. This is why people don't believe what we say. And so we have worked hard on building community trust, on combating misinformation, on ensuring there's free and easy access to COVID-19 vaccines for all New Yorkers. And we have used a framework to prioritize 33 neighborhoods that have been identified as the Task Force for Racial and Inclusion and Equity as priority for our work. And what we are doing in those neighborhoods is we are opening vaccination sites and bringing vaccines closer to the community. that have been most impacted. We have pop-up sites, we have mobile units, we have events where vaccinations are made available to make this easy and convenient for people. We are making sure that New Yorkers have the information they need in the language that they speak so that they can make clear and informed decisions about the vaccine. To ensure no one is excluded from this process because they don't have the right information. We are working closely with community-based organizations, faith-based organizations, community leaders, and this is why I'm excited to have this opportunity to discuss with you all, because you are at the forefront, engaging with the community and wanting to make sure that you all have information to cascade down to the communities that you serve. We also are listening and responding to community concerns and input. We're monitoring the data to know where we need to do more, where we need to deploy more resources so that there is no gap in our vaccination coverage. So we have vaccinations at home right now. You can pick up your phone and call 877-VAX or NYC and have a vaccinator come to your home. So if you're like, I can take time off work, I don't have time to go stand in line, you can have a vaccinator come to your home. We have walk-up vaccination site. You don't even need an appointment to get vaccinated. We have mobile vans and buses and events across the city, and you can find out where all of these are located by going to the Vaccine Command Center to get information on what is available near me. And if all of that doesn't catch your fancy, you can call and have someone come to your home and give you a vaccination. In terms of hearing from the community what their concerns are, we have done some work around that as well. And this is what we're hearing. People say, you know what, even when we take the vaccination to the community, some people are saying, no, thank you. They're like, I'm not putting that poison in my body. I am not taking the vaccine. I'm not ready for it. And these are the reasons why. We're hearing that people are worried that the vaccines were developed too quickly, that people are wanting to learn more about the vaccine before deciding, that people want to see more people vaccinated before deciding. And people are worried about how the vaccine might interact with other existing health conditions that they may have. And some people just don't trust the government. So these are some of the reasons that we're hearing why people are still holding out. And all of these are valid reasons. And so we are working to address those concerns, providing talking points and information. But one thing that we also heard is that about half of those who are not vaccinated want more information about the vaccine. So we know that knowledge is power, and people don't know where to go. They don't know who to believe. There are all kinds of rumors and misinformation and scary stuff circulating everywhere. So people want to know what is truly the facts about this vaccine. People want to learn about side effects, how well the vaccines protect, etc. So we heard from people and like, we want more information. Another thing that was interesting is that we heard from the community that incentives also help. Many people are just indifferent. They're not anti-vaxxers. They're not against the vaccine. They're just like, this is not my priority for today. It's just not something I'm worried about. For such people, incentives were, important. They say, if you were to give 100 to 200 savings bond or debit card, they said, yeah, I'll get the vaccine. And so these are some of the feedback we've heard from the community about what is it that will motivate people to get vaccinated. And this is why we have done a lot of work conducting town halls, community conversations, train the trainer, just getting information out there to as many people as we can to ensure that information is getting to those who want it. Also identifying the barriers and addressing misinformation is another area where we have put a lot of effort, and then working to support vaccine confidence even among healthcare personnel, and engaging our community partners and trusted messengers like you all who are working with the community every day. We have developed different materials and resources and communications tool. We have fact sheets, we have FAQs, we have infographics, we have different videos speaking to some of the concerns that we have heard from the community, and also social media kit. We are also elevating community voices. People need to see that community members like them, people who look like them, who speak like them, who live in their neighborhood, are getting these vaccines and are doing well. So we have community voices, we have videos of people when they're getting vaccinated and how they are reacting to the vaccination. So we have this in Spanish, we have it in English, we have it for those who have a disability, for those who are younger, for those who are older, for those who are leaders, for those who speak different languages, just helping folks to see that vaccines are the norm and that folks who look like them in their communities are getting vaccinated. We have now also rolled out incentives. Fee operated location, you can get $100 incentive. And that is in response to what we heard from the community. So that has been in operation since the 28th of July and continues to be available. So for you to see locations where this is available, you can check on the vaccine finder. And once you get your first dose, you can put in your information and redeem your incentive on the website and the link there. The city has gone a step further. We are seeing Delta charging down the road. We are seeing the third wave staring us in the face, and we have a moral and ethical responsibility to protect New Yorkers from a third wave of the pandemic. Now that we have a tool that works, now that we have evidence that most of the people who are falling sick are not vaccinated, the city has taken the additional step to roll out certain policies to keep New Yorkers safe. One of those policies is the COVID safe requirement. This requires staff to provide either a one-time proof of vaccination or weekly negative test. Again, like I said before, as long as one person is carrying this virus, none of us is safe. And to ensure that we are protecting the communities, this has been implemented. So starting the 2nd of August, all Department of Health staff, all health and hospital clinical staff have now been required to be vaccinated. Congregate setting staff, shelters, detention centers, residential care settings. These are settings where many people are indoors and vaccination protects. So in such settings, if you're an employee, we don't want you to be a source of infection to other people and you're required to be vaccinated or provide weekly negative test. And the rest of the city workforce, if you are employed by the city of New York, you are required to be vaccinated or submit weekly negative COVID test results. So another policy that has been rolled out is the key to NYC. So based on what we know and we have learned from the first wave and second wave of this pandemic, we know that there are certain hotspots for transmission. And so beginning the 16th of August, vaccines are now required for employees and customers to engage in indoor dining, indoor fitness, indoor entertainment, and performance events. So if you are going to any of these establishments, you need to be vaccinated because these are the areas where transmission have occurred in larger numbers in previous waves. So proof of vaccination can be documented via the NYC COVID Safe app, the Excelsior Pass app, or the CDC vaccination card or official record. We have got a lot of calls, people who have lost their cards, etc. So we encourage folks to take a photo of their cards and upload it into the NYC COVID Safe app or download the Excelsior Pass so that you will have that on your phone to show if you want to go into any of these establishments. Proof of vaccine is not necessary for outdoor dining or other outdoor activities. And we have started providing outreach to businesses to provide education and materials and posters for the businesses so that they are all aware of this new policy. Enforcement will start on the 13th of September. And more information is available for those who want it. There's some other updates. FDA has now fully approved the COVID-19 vaccine, the Pfizer vaccine, and it will now be marketed as Comirnaty for those who are 16 years and older. For those who are 12 to 15, Pfizer will continue to be used under the emergency use authorization. This approval comes after there has been all levels of the review that is necessary for full approval. So we hope that that will further reassures those who are still holding out that this vaccine now has full approval and can be used. So by 27th of September, all Department of Education staff, including teachers and principals, must be vaccinated. This is very important because many children right now under the age of 12 cannot be vaccinated yet. So it is important that the adults in their life that come into contact with them are vaccinated to keep our children safe. Vaccination will also be required for all students and staff participating in high-risk public school athletic leagues, sports this year. So if you have kids participating in football, volleyball, wrestling, lacrosse, rugby, and bowling, they will be required to be vaccinated. Again, this is to keep all of us safe. I like to use the analogy of, if you choose to drink, that's fine. But if you choose to drink and get behind a car, then someone needs to look out for the safety of others who might be impacted by your decision. So the public health consideration is what is driving these policies, that these are infections that's just not limited to the individual. These are infections that can transmit to other people. And some people are not able to get vaccinated to protect themselves. And so the Department of Health and the City of New York is doing everything possible to protect New Yorkers. These are testing and masking guidelines. They have been updated a little to reflect our current context. Again, COVID, it is changing information every day. So we apologize that, we need to keep on top of all the changing information. Right now, the city strongly recommends that all New Yorkers, regardless of their vaccination status, wear masks indoors in public settings. So if you're outside of your household, whether you're vaccinated or not, we encourage you to keep your mask on. This is because of what we're seeing with Delta, where we're seeing Delta is still transmissible even by those who are vaccinated. So regardless of your vaccination status, you must still wear your mask when you're on public transit, in healthcare or congregate settings, and in schools. If you are unvaccinated, please wear your mask everywhere you go that is outside of your house. Delta is not playing. We are seeing more cases, we're seeing more hospitalization, so we want everyone to stay safe and be protected. For testing, if you are vaccinated, you do not need to quarantine after an exposure, but you should get tested if you are exposed to someone who has had COVID. Now, what do we mean by exposure? We mean that you have been within 6 feet of an individual who has COVID, and your interaction lasted 10 minutes or more without face mask. That is an exposure. If you have been in that situation, we recommend that you go get tested within 3 to 5 days because symptoms of Delta start showing up as early as 6 days after exposure. And we also recommend that if you have been exposed in such a manner, you should keep on your mask for 14 days indoors to ensure you're not a source of infection to other people. If you test positive, please stay home for 10 days. That's isolation for 10 days to ensure, again, that you're not a source of infection to other people. You may have heard that there's now an additional vaccine dose required for some people. And I want to provide you some information on who those people are and what requires a third dose. So people who are moderately or severely immunocompromised due to a medical condition or treatment, and if they receive the Pfizer or Moderna vaccine, they can now get a third dose. This is different from a booster. This is a third dose of the vaccine. The people who are eligible for a third dose right now are those who have advanced or untreated HIV, those who are on treatment for cancer, and those who are organ transplant recipients and are on high-dose steroids. These are people whose immune system may not be able to react and build up antibodies as well as others. Those people need a third dose for an additional layer of protection. Now, immunocompromise does not include diabetes. it does not include heart disease, and it does not include other chronic conditions. So we are not asking at this time for other conditions to receive a third dose, only those who have severe immunocompromising condition, like I described earlier. There are 2 doses of Pfizer and 2 doses of Moderna. So what is required now is a third dose at least 28 days after either of those vaccines. This is only for Pfizer and Moderna right now. We do not have a third dose recommendation for Johnson & Johnson. And if you have questions, please talk to your provider. You must attest that you have this qualifying condition. No other documentation is required. So we have cause to celebrate all of these policies, all of these changes, all of this work. We are beginning to see some impact right now. It's early days yet, but this is just to show you that in July, this on my left is July 26th, where we started seeing increasing percent positivity, increasing confirmed cases, increasing number of probable cases, increasing total cases generally, and increasing hospitalization, and death at that time was stable. And so we deployed everything in our arsenal, and now a month after, August 23rd, this is what we see. Percent positivity is decreasing, confirmed cases are stable, hospitalization is stable, confirmed death is stable. So we want to encourage everyone that can get vaccinated to do so. This is how we stop this pandemic. And we are seeing some positive signs from all of the additional policy changes that have been made. And so we want folks to feel comfortable, especially now that we have full authorization for those who are holding out, to please go ahead and get vaccinated. So I will stop here, and I know that you will probably have a lot of other questions, and I will be happy to oblige.
Thank you so much, Dr. Ige. This was so informational, and I can see your passion to try to really help those communities that are very hesitant in getting the vaccine. So there are a couple of questions, and one of the questions is, many people haven't gotten vaccinated because they are afraid to die after getting the vaccines. They said one of the reasons that they are scared is because they have lost some family members, friends who had died 2 weeks after being vaccinated. How do you think we should address those kinds of fears?
Yeah, first I want to express condolences for anyone who's lost friends or family or loved ones to COVID or to anything else. These are traumatic situations for people, so we don't want to underestimate the impact of this on anyone. However, the data that we have right now is showing that we don't have cases where the vaccine has caused anyone to die. We have cases of death that have been reported, and when that case is reported, an investigation is done, including looking at the death certificate and autopsy to look at what is the cause of death. From all the investigations that have been done, we don't have any case where death has been a result of the vaccine. The cases where we have seen death results, we have seen some death results as a result of blood clot from Johnson & Johnson. And that are very, very few cases, but we have not seen any case of death reported that is due to the vaccine. Again, people die from different reasons or different causes, but right now from autopsies and death certificate, we haven't seen cases where it is because they got vaccinated.
So it could just be a coincidence that happened, right? And then in regards to those with deep religious beliefs and they have refused to get vaccinated, do you have any suggestions on like the best way to engage with them or speak with them in regards to?
Yes. Our recommendation is to always acknowledge everyone's truth. Whatever the person believes, the person has a right to believe it. And we want to approach conversation from a place of empathy, understanding that people have beliefs. However, we can also share with them what we know and what our experiences have been. In our interaction, we find that people connect more around personal stories than they do around science and facts. That, you know, saying to someone, this is my experience. You know, I got vaccinated. I had a headache for 1 or 2 days. I took Tylenol, I was fine. My mom waited for me to get vaccinated because she was really nervous. And then she went and got vaccinated. And then she took all her friends from her church and got vaccinated. And then my siblings got vaccinated. And then my children got vaccinated. And then everyone in the Department of Health right now is required to be vaccinated. And we're all here. We're all doing well. So just helping people to realize that, you know, some of the scary stuff that we're hearing on social media is not really true. Millions of people are here. They have been vaccinated. They're doing well. If people were dying from the vaccine, I mean, you saw the time when people were lining up, queuing for hours. If all of them were falling down and dying from the vaccine, the Department of Health will be burnt down by now. These are not things we can hide. If people are dying from this vaccine, we will see it and we will know it. So we want people to know that people are doing well. Several millions of people have been vaccinated, and just to help them feel reassured that they are in good company and they are doing well. So just being empathetic and sharing stories from real people, I think is a useful strategy to connect to people and meet them where they are.
Yeah, I've also heard one of the suggestions is for those who have actually also had the same fears, express that to them. Like, I've also had those fears, but this is the information, this is the truth, this is what I found out, and that can also help them. One of the other questions with all these policies that are coming about, how do you think that we should approach people who feel like their personal rights have been infringed upon? I think we've been seeing that a lot in the news and protests and even healthcare workers.
Right. That is a big concern. And again, we want to use a trauma-informed approach for many people in communities of color who have not been given the opportunity or the rights and privileges that others have. Anything that sounds like a mandate is very traumatic in those communities. It also provides an opportunity for people to be excluded. So the messaging around why this has become important is really important to help people feel why this has become necessary. Again, because this is a public health emergency where other people are impacted, where if we have circulating viruses, so many people can be infected. Imagine one person infecting 5 people, and each of those 5 people infecting 5 people. Within a month, we will have at least 3,200 people infected just from that one individual. So as the government, we have a responsibility to look at the community impacts and public health impacts. And that's what is driving this decision. And we want to message that so people don't feel like it is an overreach or we're not considerate of their feelings. We acknowledge that that is true. However, if we know that 33,000 people have died and we can prevent it, then we have a responsibility to do what we can to prevent. And right now, policy actions are necessary.
Yeah. I think also one of the other questions that we have here is, what are some resources that non-medical folks can use to help guide them when they're talking to their friends or families in communities of colors to help them, to help convince them to get the vaccine?
Yes, we have different materials, posters, flyers, infographic in different languages, and we also have videos. We find that a lot of people like videos, particularly videos of community, members. We have several videos of doctors, African American, Hispanic, Latino doctors, just talking about some of these issues in very simple terms that people can understand, that you can also watch for your own education and that you can share with others. But we feel like what has been most successful is really hearing personal testimonials of those who have been vaccinated from the community, beyond someone, a doctor saying, oh, it is safe, go get vaccinated. In places where trust is an issue, that doesn't resonate as much. But where you have trust and they believe, like, this is my friend, she's been vaccinated, let her share her experience with you. And this is my neighbor who's been vaccinated, and this is their experience, just to help them know that this is real and we're not just making it up because we're paid to say so.
Definitely. And I think also, I really like the slide that you had, like how many people are getting vaccinated. And as you've mentioned, so much in the news is just bad. And like there's a rise without, talking about those who are actually getting vaccinated. One of the, I guess, misconceptions, or one of the worries that a lot of young people have is that it's going to affect them in regards to getting pregnant.
Right.
How do you address that?
Yes.
Are there any statistics or research that has been done in regards to that?
Yes, we have some new data that's available. That is a concern that is very, very widespread because people just worry. Even adults that are vaccinated, some of them are saying, I don't want my kids to be vaccinated because I want them to be able to have babies in the future. So we want to say to you that we don't have any evidence at all supporting that vaccines impact fertility in any way. How do we know? So there is a pregnancy registry that is kept. When people get, those who are part of the clinical trials, and afterwards, sometimes you get vaccinated and then you you find out 2 days later that, oops, I'm pregnant. Or you get vaccinated and a month after you discover you're pregnant. My personal story, there are 3 colleagues in my office who are pregnant right now, and they're all vaccinated. Not that to say that is generalizable to everyone, but just that we have folks who are vaccinated and are getting pregnant and have no problems at all. We also have data with over 30,000 people on the pregnancy registry to show that vaccine is safe. It doesn't impact your fertility in any way. There's also a study that's been published on sperm count in men before and after vaccination, and there's not been any change. So to reassure people that, again, if 362 million people have been vaccinated, believe me, thousands of them are pregnant and are doing well. So we don't have any evidence to support that at all.
Gotcha. I think definitely that has to be super emphasized, like just saying 362, 300.
Right. It's a lot of human beings that have received this vaccine.
Like, did you know? One of the other questions is there any data saying when children younger than 12 will be cleared to get the vaccine?
Yes. We are still waiting for authorization by the FDA for children, and that's the clinical studies are ongoing. And we are hopeful that it will be concluded soon, and that will also be submitted for approval. So Moderna has submitted for approval, and Pfizer, we know, is in the works. So for children under 12, we're hopeful that within the next year or maybe sooner, we will know for sure if we can start using these vaccines in those children. But the studies are still ongoing and we're waiting for approval.
Okay, and once that happens, do you think that this vaccine is going to become part of the list of required vaccines for children?
Oh yes. Right now, I don't see that there's any other threat that is as severe as COVID right now, based on the number of people and how it has spread. I mean, not measles, not chickenpox, not polio has had the impact that this virus has had. So this is one of the biggest challenges we've faced in over 100 years. So yes, it will become mandatory.
I'm hoping for this to just be the norm. Like, oh, it's just in the past.
Yeah,
So one of the other questions is, many people with co-occurring illness such as HIV or asthma are very hesitant to get the vaccine. What would be the best way to go about talking to them?
So
in regards to getting vaccinated?
Yeah, decision about vaccine considers three things: risk, benefit, and convenience. So let's start with the risk. If you're HIV positive, you are even more prone to severe illness. If you have diabetes, if you have severe asthma, these are people that are more prone to severe COVID. So you have a higher risk. Now, let us look at benefits. The vaccines have been shown to be safe in people with underlying condition. We don't have any condition right now that excludes you from being vaccinated. We don't have drug interactions with this vaccine. So the benefits are there. And is it convenient? Certainly. You can even call someone and you don't even have to step out of your home to get vaccinated right now. So this is what we want folks to consider. There are benefits to protecting yourself from vaccination. And another thing to note is that the majority of people who have died from the vaccine have had underlying or comorbidities as well. So this is why if you have an underlying condition, you should be first in line to be protected, just because of how the virus can affect you. So yes, it is safe, and we should encourage those who have underlying conditions to talk to their providers if they have additional questions. But right now, you are not excluded. You can be vaccinated, and safely so.
And for those who have been exposed to COVID and have had it, and what would you say to a person who had COVID, has the vaccines, and doesn't want to get the vaccine because of that?
Yes. So again, referring back to the data, we are seeing reinfection happen. So if you've had COVID, you will be protected for a little while, about 90 days, and then the antibodies stop protecting you, and then you can get reinfected. So the data that we have right now shows that those who have had COVID in the past are 2 times more likely to be reinfected compared to those who have been vaccinated. So while we're seeing reinfections happen, starting from like 90 days after recovery, we're not seeing the same high rates in those who are vaccinated. So vaccination provides an additional layer of protection, an additional layer of cellular immunity that we don't always see with natural immunity, particularly for the Delta variant. So the vaccine offers a stronger protection than natural immunity for the Delta variant and for the virus generally. So yes, please think about it. Having an additional layer of protection will not take anything away from you. It will just make you feel safer, and it is safe to be vaccinated.
Gotcha. And I know you mentioned the incentives. Is that for all those who are providing the vaccine, or is that for like just city-owned places that are getting the vaccine, where you can get the vaccines for the $100?
Yes, so the $100 is available in locations that are present on the vaccine finder. So if you're on that list, then you will be able to offer the $100 incentive. So most of them are city sites, but there are some federally qualified health centers that are also able to provide the $100 incentive. And we're trying to expand that to other locations.
Yeah, and I actually used it recently for one of my cousins. It's actually really so much easier than it was in the beginning.
Yeah.
So I really appreciate that.
We're getting better.
Yeah. Okay. So one of the other questions is, are home visits recommended when children are not vaccinated and immunocompromised?
So if you're doing home visits, we want to ensure that you are vaccinated. The best thing you can do for the children around you right now is to be vaccinated. That way, at least you're protected. You're not likely to be a source of infection to them. And to also maintain all of the other precautions. Wear your mask, maintain social distance, if you are going to be interacting with someone who's immunocompromised or who is not vaccinated. So this is what we're saying, regardless of your vaccination status, if you're going to be indoors with someone that is not from your household, who is not vaccinated, please keep your mask on for their protection as well as yours.
Okay. The other question we have here is, were there any clinical trials on children with the Pfizer vaccine?
Yes. So clinical trials, the first phase of clinical trials, or the first round of clinical trials, was for those who were 16 and older. Once that had approval, authorization, then, and we saw that adults were using the vaccine and are doing well, then they started the clinical trials for those who were 12 to 16. Now they have authorization for that, and that's going on well. Children are being vaccinated, they're doing well. Now they started the clinical trials for those who were 2 to 12. So that is ongoing, and once that is approved and we're rolling it out, then I suppose they will go down lower if necessary. So that's where we are right now. The clinical trials are ongoing.
Okay, awesome. So we have one more question, and this will be, okay, are there any clinics in Lower Manhattan for COVID long haulers?
Yes, we have some centers for excellence for those who have long haul. So right now it appears about 1 in 4 people who recover from COVID have a persistent symptom. That's called long haul. So I don't know all the locations off the top of my head, but there's one in Queens, and I can find that information and put it in the chat for you. But you know, the city has started some centers of excellence for long haulers to just help provide some support for those who are you know, suffering from the persistent symptoms after recovering from COVID.
And those centers are called Centers of Excellence?
Yes.
Okay, cool. Well, thank you so much, Dr. Ige. It's a pleasure to speak with you again and have this conversation. Thank you so much.
Thank you for having me, and thank you for being such engaged audience. We know that there's still a lot of questions, so please, if anything else comes along that you want me to weigh in on, please feel free to send it to me and I will try and respond.
Thank you.
Fantastic. Thank you so much again, Dr. Ige. This has been really informative, and I hope helpful to everybody who attended. We'll be sharing slides and recording with Department of Health permission. I do believe, and thank you, Ivette, also. You're a fantastic moderator, and I know it was hard to get through all of the questions. I know we didn't get to everybody's questions, but please do feel free to reach out to us, and we can work with Dr. Ige to get those questions answered. I do believe we have a quick poll. If Dina, you can put that in the chat. We'd love to get people's feedback on this session, whether you found it helpful. It should be popping up on your screen now. If you can scroll down, I think there's 5 or 6 questions, 4 questions, sorry. And yes, thank you to our partners. Also the NYU Community Health Worker Research and Resource Center, the Department of Health, NYU Brooklyn Health and Housing Consortium, and New York SEAL, NYU-CUNY Prevention Research Center, also partners of ours on a lot of the webinars we do. And thank you, Dina and Harmony, also for your help. We look forward to seeing everybody at our next webinar. Thank you again, everybody.